In today's nursing mindset video, we're going to discuss urinary elimination. So today's nursing mindset is this: identify the underlying cause of the patient's urinary problem, not just the symptom. Now it sounds simple, but this one mindset changes the way you think as a nurse. Many urinary problems present with similar symptoms. A patient may tell you they're leaking urine, going to the bathroom more often, experiencing urgency, or having difficulty emptying their bladder. If we focus only on the symptom, we may choose the wrong intervention. Instead, nurses pause and ask one simple question: why is this happening? The question guides every assessment, every intervention, and ultimately leads to better patient outcomes. As you follow along with the infographic, don't think of it just as something to memorize. Instead, use it as a guide for how nurses organize their thinking when caring for patients with urinary elimination problems. Let's start with one of the most common urinary concerns: incontinence. Imagine 4 different patients who all tell you they're leaking urine. At first glance, it sounds like the same problem, but once you begin asking questions, you realize each patient has a different reason for the leakage. One patient leaks urine every time they cough or laugh. Another experiences a sudden, overwhelming urge to urinate and can't make it to the bathroom in time. A third patient recognizes the need to urinate, but recently had surgery and can't get to the bathroom quickly enough. A fourth patient has a bladder that isn't emptying completely, causing overflow leakage. The symptom is the same: urinary leakage, but their underlying cause is different. Because the cause is different, their nursing interventions are different. A patient with stress incontinence may benefit from pelvic floor muscle training. A patient with functional incontinence may need scheduled toileting, assistance with mobility, or environmental modifications. A patient with overflow incontinence requires an entirely different assessment because the problem may be urinary retention rather than bladder control. The key isn't to just memorize the different types of incontinence. The key is recognizing that the intervention must match the cause. The same way of thinking applies when caring for patients with possible urinary tract infections. Many students quickly memorize the classic symptoms: burning with urination, urgency, frequency, cloudy urine, or foul-smelling urine. And those are certainly important assessment findings, but they don't tell the whole story. For example, an older adult may present with confusion or a sudden change in mental status before reporting any urinary symptoms. If we're only looking for burning or frequency, we may miss an early urinary tract infection. On the other hand, not every urinary symptom means a patient has a UTI. As nurses, we gather assessment findings, review laboratory results, consider the patient's history, and look at the entire clinical picture before reaching a conclusion. Just as importantly, we think about prevention. Many urinary tract infections can be prevented through simple nursing interventions, such as encouraging adequate hydration, promoting regular bladder emptying, reinforcing proper perineal hygiene, and avoiding unnecessary catheterization whenever possible. Remember, one of the most important responsibilities of a nurse is preventing complications before they occur. Another tool that helps us identify the underlying cause is a bladder scan. Students sometimes think the bladder scan is simply another piece of equipment that gives you a number, but in reality, it's a tool that helps answer an important clinical question. Imagine your patient hasn't voided for 6 hours. Your first thought shouldn't be the patient needs a catheter. Instead, ask yourself, why hasn't this patient voided? Is the bladder full because the patient is retaining urine? Or is the bladder nearly empty because the kidneys aren't producing urine? Those are 2 very different situations requiring 2 very different interventions. The bladder scan provides another assessment cue, but it never replaces clinical judgment. Nurses combine the bladder scan results with the patient's symptoms, physical assessment, recent intake and output, medical history, and overall condition before deciding on the safest next step. Finally, remember that some of the most effective nursing interventions don't involve medications or procedures at all. Patient education plays an important role in promoting healthy urinary elimination. Teaching patients about proper hydration, preventing constipation, limiting bladder irritants when appropriate, strengthening the pelvic floor, practicing bladder retraining, and establishing scheduled toileting routines can significantly improve urinary function while promoting independence and quality of life. These interventions may seem simple, but they have a tremendous impact on a patient's daily life. Notice that none of these interventions are chosen randomly. They're selected because they address the patient's specific problem. That's what clinical judgment is all about. Every assessment finding gives you another clue. Every intervention should have a purpose, and every nursing decision should be based on understanding the underlying cause of the patient's problem. I'd like to leave you with one final thought. Remember today's nursing mindset. Identify the underlying cause of the patient's urinary problem, not just the symptom. Every urinary symptom is a cue, but it's only one piece of the clinical picture. Before choosing an intervention, pause and ask yourself, why is this happening? When you focus on identifying the underlying cause, you're able to choose interventions that are safer, more effective, and truly patient-centered. That's the nursing mindset. Keep developing yours.